Hello, class of 2019 and instructors. Today the medical term that I'll be focusing on is candidiasis. So that's different infections mainly focused on the disease by fungi genus Candida. There's over 20 different species. Now everyone has a little bit of Candida in them already, but when the fungi becomes worsened or the imbalance is overpushed, then that's where it really becomes a health issue. So first one, I'm going to take a look at 3 different examples given by the CDC's website. That's what we're going to kind of focus on throughout this assignment. So first one's going to be oral. That's generally referred to as thrush. There's also vaginal, which is referred to as a yeast infection. And then that's invasive, which is really what I wanted to focus on mainly today. Candidiasis affecting the bloodstream and any organs that the blood can get to, such as the heart, brain, eyes, and any other important organs. And that really is important because especially the risk factors with this one is going to be those patients who went through chemotherapy or weakened immune system, diabetes, or any other surgery. So that's going to be a lot of patients that we're going to be working with. So signs and symptoms will depend on which variation of the candidiasis that the patient has. So if it's oral, you'll notice white patches either along the tongue or the cheeks. Another thing is you'll notice cracks along the sides of their mouths, pain with swallowing or eating, and then also cotton or dry mouth. So those are things you can kind of keep an eye on. Vaginal is going to be more focused on women's health because again, not everyone's going to tell you this. So it's itching, soreness of the groin area, or pain in urinating, or pain with sexual intercourse. Next is going to be invasive, again, the one that I mainly want to focus on. So those symptoms are going to be a little bit different because it's wherever the blood can get to. So anything along the body will be affected. Also, another red flag that we want to keep an eye out for is if any fevers or chills are not resolved by antibiotics, and that's really what I want to focus on. There's different tests done for each one. So a mouth swab is done for the oral, a vaginal discharge is taken for the vaginal, and then for invasive, you mainly kind of take a look at their blood. So you get a blood sample and then send it off to a lab, get it back a couple of days, and take a look at it. Generally, the treatment that I found best with the resources that I looked at was going to be through medication, antifungal medication. There's different forms of it. There's gels, there's pills, there's antifungal mouthwashes, and even, again, going back to that invasive, the initial dose that most of the time they recommended, especially in worst cases, is using through IV and then going on to through the mouth, through the pills, and through the gels. But main probable diagnosis, if you get those other 2 that I mentioned, so oral or vaginal candidiasis, then that's really not really going to get an issue as long as you catch it in time. But the other one, invasive, is really where you need to keep an eye on it. One research that I found said that the mortality rate would be between 19 and 24%. So that's a little bit different because, again, as I mentioned the risk factors, you notice there's going to be immune system lowness, diabetes, surgeries, weakness already that's involved. So it might be a little bit different. But main thing and last thing I want to focus on is the PT treatments. So us as PTAs are really going to be dealing with these patients. And through all of the things that I just listed, you'll notice that yeast infections can really be controlled, by the most part, with good hygiene. So we've been kind of working with bed mobility lately, and that's going to really be important for them, is being able to move around, especially those who are bedridden and those who are dependent assistant. We really want to be able to get them to move around and be able to clean themselves as much as they can. And that way they can live functional and the best life that they can have. Thank you. Hope you have a great rest of the day.